Symptoms, causes, and treatment of epilepsy. Dr. Jeysen, Remy, Plantin. The Centers for Disease Control and Prevention, CDC, describe epilepsy as a common neurological condition characterized by recurrent seizures. Epilepsy is a neurological disorder. Primary symptoms commonly include seizures. Seizures have a range of severity depending on the individual. Treatments include anti-seizure medications. Now, the main symptoms of epilepsy, the main symptom is repeated seizures. If one or more of the following symptoms are present, the individual should see a doctor, especially if they recur. A convulsion with no temperature, no fever, a short spells of blackout or confused memory, intermittent fainting spells during which bowel or bladder control is lost, which is frequently followed by extreme tiredness. For a short period, the person is unresponsive to instructions or questions. The person becomes stiff suddenly for no apparent reason. The person suddenly falls for no clear reason. Sudden bouts of blinking without apparent stimuli, and sudden bouts of chewing without apparent reason. For a short time, the person seems dazed and unable to communicate. Repetitive movements that seem inappropriate. The person becomes fearful for no apparent reason. They may even panic or become angry. Peculiar changes in senses such as smell, touch, and sound. The arms, legs, or body jerk. In babies, these will appear as a cluster of rapid jerking movements. Now, they may present similar symptoms and are sometimes misdiagnosed as epilepsy. Okay, so high fever with epilepsy-like symptoms, fainting, narcolepsy or recurring episode of sleep during the day, cataplexy or periods of extreme muscle weakness, sleep disorders, nightmares, panic attacks, fugue state, a rare psychiatric disorder, and psychogenic seizures. Now, causes. How does a person get epilepsy? Every function in the human body is triggered by messaging systems in our brain. Epilepsy results when this system is disrupted due to faulty electrical activity. In many cases, the exact cause is not known. Some people have inherited genetic factors that make epilepsy more likely to occur. Now, other factors that may increase the risk include head trauma, brain conditions, infectious diseases, prenatal injury, and developmental disorders. It is most likely to appear in children under 2 years of age and adults over 65 years. Now, what a patient with epilepsy experiences during a seizure will depend on which part of the brain is affected and how widely and quickly it spreads from that area. The CDC note that the condition is not well understood. Often, no specific cause can be identified. Now, how common is epilepsy? In 2015, epilepsy affected 1.2% of the population in the United States, or 3.4 million people, including 3 million adults and 470,000 children. The World Health Organization estimates that epilepsy affects 50 million people worldwide. Now, what about the treatment? Is there any cure, any treatment for epilepsy? There is currently no cure for most types of epilepsy. However, surgery can stop some kinds of seizures from occurring, and in many cases, the condition can be managed. If an underlying correctable brain condition is causing the seizures, sometimes surgery can stop them. If epilepsy is diagnosed, the doctor will prescribe seizure-preventing drugs or anti-epileptic drugs, AEDs. Now, if drugs do not work, the next option could be surgery, special diet, or VNS, vagus nerve stimulation. Now, the doctors aim to prevent further seizures from occurring, while at the same time avoiding side effects so that the patient can lead a normal, active, and productive life. Anti-epileptic drugs, AEDs. The majority of AEDs are taken orally. The type of seizure the patient is having will decide which drug the doctor may prescribe. Patients do not all react in the same way to drugs, but AEDs appear to help seizures in 70% of the cases. Now, drugs commonly used to treat epilepsy are included in that table. You see you have 4 of them, and on the right this is the formula for sodium valproate, the first one. Some drugs may stop seizures in one patient but not in another. Even when the right drug is found, it can take some time to find the ideal dose. Now, life expectancy of people with epilepsy. Okay. Now, in 2013, researchers from the University of Oxford and University College London in UK reported that people with epilepsy are 11 times more likely to experience premature death compared with the rest of the population. The risk appears to be greater if the person also has a mental illness. Suicides, accidents, and assaults accounted for 15.8% of early death. Most people affected by these had also been diagnosed with a mental disorder. Now, guys, this is it. Okay, this is the end. Thank you for watching. This is a short summary related to epilepsy and seizures. Okay, subscribe. Don't forget to subscribe to my videos for more medical topics in the future. Now, if you have any questions, of course, leave me a comment below this video, and may God bless you. All right, thank you very much for watching, guys. Have a blessed day.